Hello, my name is Crystal Spakes, and this PowerPoint is on Alzheimer's disease. When I first learned about this disease, I just thought that it was a brain disease which fed on the brain, causing the individual to have memory loss. After doing vigorous research, I learned that there's a lot more to Alzheimer's than I originally thought. To begin talking about Alzheimer's, I need to first discuss dementia. Dementia is an umbrella term describing a variety of diseases and conditions that develop when nerve cells in the brain die or no longer function normally. The death and malfunction of these neurons causes changes in one's memory, behavior, and ability to think clearly. In order to be diagnosed with dementia, an individual must have evidence of significant cognitive decline, so maybe a decline in memory, language, or learning. And the cognitive decline must interfere with independence in everyday activities. So they may need assistance with complex activities such as paying bills or managing medications. This is a criteria for a diagnostics and statistical manual of mental disorder for major neurocognitive disorders. There are different types of dementia, some of them being vascular dementia, which is caused by brain damage from cerebrovascular or cardiovascular problems, usually stroke, and is the second most common cause of dementia. Frontotemporal dementia, which is a group of diseases characterized by degeneration of nerve cells, especially those in frontal and temporal lobes of the brain, hence the name. There's Huntington's dementia, which is a familial disease, meaning it's passed from parent to child through a mutation in the normal gene. There's Lewy body dementia, which occurs when cells in the brain's cortex, or outer layer, and in a part of the midbrain called substantia nigra. The remaining nerve cells in the substantia nigra contain abnormal structures called Lewy bodies, which is where the name comes from. The most common type of dementia is Alzheimer's and is the focus of this PowerPoint. Alzheimer's disease is an irreversible progressive brain disease that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest tasks. In most people with Alzheimer's disease, symptoms first appear after age 60. Alzheimer's disease was so poorly understood that people who suffered this dementia were labeled as tormented, affected, weird, senile, crazy, and spellbound. They were feared, avoided, ignored, and ridiculed. Over the centuries, they suffered terrible and inhumane treatment when their families hid them from the public, restrained them at home, incarcerated them in locked rooms, and committed them to insane asylums. It even went so far that some believed they were possessed by demons, others accused of witchcraft, and some were even burnt at the stake. There was no public awareness about it until Dr. Alois Alzheimer described the disease with a 51-year-old patient he had. Dr. Alzheimer noticed changes in the brain tissue of this woman, who he thought died of an unusual mental illness. Her symptoms included memory loss, language problems, and unpredictable behavior. After she died, he examined her brain and found many abnormal clumps and tangled bundles of fibers. There are two main types of Alzheimer's disease: early onset and late onset. Early onset is related to specific gene mutations. It's a rare form and affects only about 5% of all people who have Alzheimer's and develops in people ages 30 to 60. Some cases of early onset Alzheimer's are inherited, and this is called familial Alzheimer's. Familial Alzheimer's disease is caused by a number of different gene mutations causing abnormal proteins to be formed. Most cases of Alzheimer's disease are going to be of late onset form, which means they develop after age 60. Scientists studying the genetics of Alzheimer's disease have found that the mutations seen in early onset Alzheimer's disease are not involved in the form of late onset Alzheimer's disease. This PowerPoint is going to focus on the late onset form of Alzheimer's. Alzheimer's disease is a neurodegenerative disease that is caused by abnormal proteins, amyloid B and tau protein, which emerge and multiply drastically in the brain. I will get more into these proteins later on in this presentation. Scientists don't fully yet understand what causes Alzheimer's disease, but it is clear that it develops because of a complex series of events that take place in the brain over a long period of time. It is likely that the causes include genetic, environmental, and lifestyle factors. Age is the most important risk factor for Alzheimer's disease. The prevalence is about 8% among people over age 65 and doubles every 5 years to reach close to 40% among 85-year-olds. There are a few other risk factors that seem to affect Alzheimer's, so having diabetes, hypertension, or high cholesterol can cause Alzheimer's disease, so eating healthy and exercising is a great way to reduce those risks. Another risk factor is being female. The use of estrogen was initially thought to protect against the development of Alzheimer's disease, but later on, a Women's Health Initiative study showed that estrogen therapy actually increased the risk of developing dementia and cerebrovascular events. Recent research has shown that there is an excess of cholesterol and plaque seen in the brains of patients with Alzheimer's disease. Apolipoprotein E is a protein that helps transport blood cholesterol from the liver to various organs in the body. This gene is found on chromosome 9 and has 3 alleles, epsilon 2, 3, and 4. Having 1 or 2 copies of the epsilon 4 allele appears to increase the risk of developing later onset Alzheimer's disease. Research evidence suggests an interaction between genetic and environmental factors in developing Alzheimer's disease. Controlling the environmental risk factors in a genetically predisposed individual can reduce the risk of Alzheimer's disease. Some ways to reduce risk in your environment is having a nutritious diet, physical activity, and social engagement. Some early signs of Alzheimer's disease is memory loss that disrupts daily life, so if they forget the route home or can't remember where they left their car in the parking lot, or just forgetting important dates and events. Some other early signs of Alzheimer's are challenges in planning or problem solving. So maybe they struggle with a familiar recipe or keeping track of monthly bills. They may have confusion with time or place, so forgetting where they are or how they got there. They may have problems with words in speaking or writing, so they may have trouble following or joining a conversation. They may misplace things and lose the ability to retrace steps. Occasionally they may have decreased or poor judgment, so making a bad decision once in a while. They may have mood and personality changes. Now, since these are early signs, they may not be as noticeable, meaning that some things on this list we have gone through ourselves, but with Alzheimer's disease, it becomes progressively worse. The reason some of these symptoms are occurring is because the damage to the neurons in the brain is happening in the frontal lobe. The frontal lobes are involved in motor function, problem solving, spontaneity, memory, language, judgment, impulse control. So basically, the frontal lobe is really important, and its role is regulating behavior and helping prevent us from saying or doing things that might be viewed as inappropriate. Alzheimer's disease ultimately affects all parts of the brain, but early signs of Alzheimer's disease suggest that damage begins or is more drastic in the frontal lobes of the brain. So now we're going to talk a little bit about the prevalence of Alzheimer's disease. Alzheimer's accounts for approximately 60 to 80% of all diagnosed cases of dementia. It's estimated that 4 million people in the U.S. have it, and 15 million people worldwide have Alzheimer's. So 1 in 9 people over age 65 have Alzheimer's, about 1/3 of people over age 85 have it, and a vast majority of people over the age of 75 have Alzheimer's. More women than men have Alzheimer's disease. The observation that more women than men have Alzheimer's disease and other dementia is primarily explained by the fact that women live longer on average than men, and older age is a greater risk factor for Alzheimer's. Older African Americans and Hispanics are more likely than older Caucasians to have Alzheimer's disease, and in recent studies it even shows that people with fewer years of education appear to be at higher risk of Alzheimer's disease than those with more years of education. And at least 36,000 Americans are diagnosed with Alzheimer's each year, and 50 of those Americans are reported to die from Alzheimer's disease. So Alzheimer's and the brain. No one knows exactly what starts the Alzheimer's disease process or why some of the normal changes associated with aging become so much more extreme and destructive in people with the disease. It is known, however, about what happens in the brain once Alzheimer's takes hold. The damage to the brain begins as soon as 10 to 20 years before any problems are evident. That's a long time. As I said, Alzheimer's disease is a nerve-damaging disease that has abnormal clumps of protein inside and outside the nerve cells that interrupt the network of neuron communication and eventually destroys those neurons. The protein that gathers outside the neurons is called amyloid beta. Amyloid beta collects in the form of large clusters called amyloid plaques, which are highly toxic to neural cells and physically interrupt their connection. The protein that piles up inside the neurons is called tau protein. And this protein is present in abnormally high amounts inside neurons, where it groups into larger structures called neurofibrillary tangles. Neither neurofibrillary tangles nor amyloid plaques are specific lesions found only in Alzheimer's disease. However, the presence of both of these lesions in large amount signals the presence of Alzheimer's disease. There is a gradual loss of connections between neurons as Alzheimer's progresses. Neurons need to communicate with one another, which they do at the synapse. Since the 1980s, new knowledge about plaques and tangles has provided important insights into their possible damage to synapses. Alzheimer's disease inhibits communication between neurons to the point that they cannot function properly and eventually die. As neurons die throughout the brain, the affected regions begin to shrink in a process called brain atrophy. By the final stage, damage is widespread and brain tissues has shrunk significantly. So this slide just reiterates what I was saying in the last slide about how Alzheimer's affects the brain. I just broke up the steps a little bit more so that you can see the process of how it affects the brain a little bit more easier. If you look at the slide on the right, you'll see what I was talking about with the brain atrophy. In the Alzheimer's brain, the cortex shrivels up, damaging areas involved in thinking, planning, and remembering, so basically frontal. And it's especially severe in the hippocampus, an area of the cortex that plays a key role in formation of new memories. And if you also take a look, you can see the ventricles, which are fluid-filled spaces within the brain, are growing larger, so that that fluid, instead of being compacted in their little ventricles, can surround the brain and get into all of the different areas. And this is not a good thing. So if you see the picture, the left is of the normal size of the brain and the right is of someone who has Alzheimer's disease. And you can see how much smaller it is compared to someone of a normal brain function. Now I'm going to talk a little bit about diagnosing dementia. Although doctors know that Alzheimer's disease and other causes of dementia are distinct diseases, in the early stages, it is difficult to differentiate between the onset of Alzheimer's disease and other types of age-related cognitive decline. A definitive diagnosis is only possible after death during an autopsy. With all the tools available, however, experienced physicians can be reasonably confident about making an accurate diagnosis of Alzheimer's disease in a living person by getting a detailed patient history. They will conduct physicals and neurological examinations and laboratory tests. They may also do a CT scan or MRI test, which detects strokes or tumors and can reveal changes in the brain structures that indicate early Alzheimer's. And those changes can include if there's plaques and tangles in the scan or if the brain seems to be shrinking. The ideal treatment option of Alzheimer's disease is something that could stop the process of toxic protein. Unfortunately, that does not exist yet, despite extensive research. However, there are some other treatments that slows down the process. There are several drugs that are helpful. One large group of drugs improves the ability of neurons to communicate between themselves. These groups are called cholinesterase inhibitors and memantine. Although they do not stop the disease process, these drugs modestly improve cognitive performance and slow down progression of disease symptoms. Behavioral techniques are used to ensure safety, assist with self-care, prevent behavior problems, and improve medication compliance. Behavioral treatments used in Alzheimer's disease include the management of inappropriate behaviors, assisting with activities of daily life, and the identification of resources available in the community. There was a breakthrough in treatment with the invention of a vaccine that was shown to work successfully in transgenic mouse models of Alzheimer's disease. When they were injected with the vaccine, instead of amyloid beta going from the blood to their brain, it went from their brain into the bloodstream and resulted in clearing amyloid beta deposits in their brain and reversing the memory loss observed in these mouse. A human trial study was done using the vaccine, and a year after the trial started, 18 patients displayed symptoms of brain inflammation and 1 died after that. The trial was canceled for safety reasons, but this gives hope that there is a cure for Alzheimer's disease. In conclusion, Alzheimer's disease is a neurodegenerative disease that causes an abnormal amount of plaques and tangles that form in the brain, causing neuron damage and decay. This is just a picture explaining how Alzheimer's disease affects the brain. It's a picture of a healthy brain, how the brain digresses with mild Alzheimer's disease and then severe, and then a picture of what a healthy neuron should look like, and then a picture of how a neuron looks like when that person has Alzheimer's disease. Thank you for listening to my presentation, and I hope you learned a little bit more about Alzheimer's disease.